In the autumn of 2013, a seemingly benign injury led to a life-altering diagnosis for a woman who had been grappling with vague and persistent symptoms for over a year. Chronic myeloid leukemia, CML, a type of blood cancer that often creeps in quietly, had been lurking in her body, unnoticed by those who should have been its first line of defense. The misdiagnosis and delayed recognition of her symptoms reveal a broader issue within the medical community: the challenge of identifying blood cancers when they present with nonspecific or easily dismissible signs. Her story is not unique. Across the world, thousands of individuals suffer in silence as their bodies send out distress signals that are too often ignored or attributed to less serious conditions. These early warning signs are the body's attempt to alert us to the silent war being waged within, a war that, if caught early, could be won with the right interventions. Yet, the subtlety of these symptoms frequently leads to misdiagnosis or delayed treatment, with devastating consequences. Tiredness is a common complaint, one that most of us have experienced at some point. It is often dismissed as a result of a busy lifestyle, stress, or simply not getting enough sleep. However, when this fatigue becomes persistent and overwhelming, it may be an indication of something far more serious. In the case of CML and other blood cancers, the body is slowly being deprived of its vital components, red blood cells, white blood cells, and platelets, as abnormal cells proliferate uncontrollably. This depletion manifests as unrelenting tiredness, the kind that doesn't go away with rest or sleep. For many, this fatigue is the first sign that something is wrong, yet it is so easily attributed to less concerning causes. As fatigue takes hold, other symptoms begin to emerge, each one easily mistaken for the everyday ailments of a stressed or aging body. A loss of appetite might be written off as a consequence of stress or depression, especially when life is filled with the turmoil of caring for a loved one with a terminal illness. But when this lack of appetite is accompanied by unexplained weight loss, it should raise alarms. The body, now under siege, is no longer able to sustain itself as it once did. The cancer cells are consuming resources at a faster rate than the body can replenish them, leading to this often overlooked symptom. The skin, our largest organ, can also reveal the presence of blood cancer, but its warnings are often overlooked or misunderstood. Easy bruising or unusual bleeding are telltale signs that the body's platelet count is dangerously low. These platelets, essential for clotting, are diminished as cancerous cells take over the bone marrow. What might begin as a minor bruise or a small cut that bleeds longer than expected can escalate into something far more serious. For many, like the woman in our story, the bruises appear mysteriously, with no recollection of injury, or they grow alarmingly large from minor impacts. Yet, even these visible signs can be dismissed, particularly if the person is under stress or has other explanations for their condition. Bone and joint pain, while not exclusive to blood cancers, is another symptom that can signal the presence of a malignancy. In the early stages of CML, patients might experience diffuse pain throughout their muscles and joints. This pain is often misinterpreted as arthritis, fibromyalgia, or simply the wear and tear of an active life. The pain may be persistent, waxing and waning over time, making it difficult to pin down a cause. It's only when the pain becomes unbearable or is coupled with other symptoms that the possibility of a more serious underlying condition is considered. Infections are a common part of life, particularly during certain times of the year when viruses and bacteria are more prevalent. However, when infections become frequent, severe, or unusually difficult to shake off, they may be a sign that the immune system is compromised. In blood cancers like CML, the white blood cells responsible for fighting off infections are either reduced in number or rendered ineffective by the cancer. This leaves the body vulnerable to illnesses that would normally be easily defeated. What starts as a cold that lingers too long or a minor cut that refuses to heal can quickly escalate into a more serious infection, putting the patient's life at risk. The story of this woman's journey through the healthcare system highlights another critical issue: the tendency of medical professionals to attribute symptoms to stress, particularly in patients who are under significant emotional strain. In her case, the stress of caring for a dying parent was seen as a plausible explanation for her fatigue, loss of appetite, and even her bruising. This assumption led to a series of missed opportunities for early diagnosis. While stress can undoubtedly have a profound impact on the body, it is crucial that healthcare providers remain vigilant and consider the possibility of more serious conditions when symptoms persist or worsen. The tragedy of a delayed diagnosis is that it not only robs the patient of precious time, but also leads to a more difficult and prolonged treatment journey. Had the woman in our story been diagnosed earlier, her treatment options might have been less aggressive, her prognosis more optimistic. Instead, she endured months of uncertainty, her condition worsening as the cancer silently progressed. This case also underscores the importance of self-advocacy in healthcare. Patients must feel empowered to question their doctors, to push for further testing when their symptoms are not improving, and to seek second opinions when necessary. It is a sad reality that sometimes, even well-meaning healthcare providers can miss the signs of a serious illness. Patients and their loved ones must be vigilant, particularly when the symptoms are as subtle and insidious as those associated with blood cancers. In retrospect, the signs were there all along. The fatigue that wouldn't go away, the loss of appetite, the mysterious bruises, the persistent pain in her muscles and joints. Each symptom was a clue to the underlying disease. But in the absence of a clear diagnosis, each symptom was treated as a separate issue, rather than pieces of a larger puzzle. It wasn't until the bruising became too severe to ignore that the true cause of her symptoms was finally revealed. For those living with blood cancer, early diagnosis is key to successful treatment. Yet, as this story illustrates, the path to diagnosis can be fraught with obstacles, from misattributions of stress to the dismissal of symptoms that seem too vague to warrant concern. It is imperative that both patients and healthcare providers recognize the importance of these early warning signs. Only then can we hope to catch blood cancers like CML in their early stages, when treatment is most effective and the chances of remission are highest. The story of this woman's delayed diagnosis serves as a cautionary tale, a reminder that our bodies often know when something is wrong long before we do. It is up to us, and the medical professionals we trust, to listen to those signals, to dig deeper when the answers aren't clear, and to never dismiss a symptom simply because it doesn't fit neatly into a diagnostic box. The cost of missing these signs is too high, the stakes too great. As we move forward, we must strive to educate both patients and healthcare providers about the early symptoms of blood cancers. Awareness is the first step in prevention, and early detection is our best weapon against these silent killers. By recognizing the signs and acting quickly, we can save lives and give those diagnosed with blood cancer the best possible chance at a full and healthy life. If you or someone you know has been experiencing unexplained fatigue, persistent pain, unusual bruising, or other subtle symptoms that just don't seem right, don't hesitate to seek medical advice and push for answers. Early detection can make all the difference, especially when it comes to blood cancers like leukemia. Trust your instincts, advocate for your health, and remember, you're not alone on this journey. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more content on health awareness and support. Your health matters. Take care and stay informed.